I'm Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. The number of COVID cases in the United States and in Dallas County specifically are dramatically increasing. In Dallas, COVID cases have increased 189% over the last 2 weeks, and hospitalizations are up 94% in that same time period. Dallas County has raised their COVID threat level to red because of these increases in the high risk of transmission. Doctors working in the hospitals say the patients in the hospitals that they're seeing right now are not like the patients that they saw last year at the beginning of the pandemic. The current patients are almost always unvaccinated, and they tend to be younger, many in their 20s and 30s, and they seem sicker than younger patients who were getting last year and often are worsening much more rapidly. 96% of samples tested in the last week at UT Southwestern have been the Delta variant, and this reflects what's seen nationwide. But despite these frightening statistics, the vaccination rate in Texas ranks 36th in the country. We can do better than this, Texas. Some of our fellow Texans are unable to get the vaccine yet because they're under age 12. That's 5 million Texans. But there are still 9 million Texans who are eligible to get vaccinated but haven't done so. This is especially a problem in the more rural counties and in some predominantly Black and Hispanic neighborhoods. Several of my patients said to me this week, "I'm sure I'll get the vaccine eventually, just not right now," or "I'm just not ready yet." And my question for them is, what are you waiting for? Now is the time. This vaccine will keep you out of the emergency room. It will help keep you out of the hospital and the ICU and off the ventilator. It can save your life. If you haven't gotten yours yet, please get it now. Even if you won't do it for yourself, do it for your children or your family members who are elderly or immunocompromised. If you have friends or family who are reluctant to get the vaccine, talk to them about the facts and steer them away from the misinformation that's prevalent across social media. Tell them how important this is. Tell them you love them and you want them to be safe. Tell them you want their young children protected too, and the best way to do that is to vaccinate themselves. To prevent the development of new and even more dangerous variants, we need to stop this spread, and vaccination is the way to do it. There's a lot of discussion about COVID booster shots recently. They're starting to give those in some other countries, especially for older patients or those who are immunocompromised. At this time, the FDA and the CDC have not given their recommendation to get booster shots because they haven't reviewed all the data from the pharmaceutical companies about the need and efficacy of a third shot and which shot may be needed or when it might be needed. We will have more information on this very soon, so please be patient and wait for the science to guide us. And if you are someone who's unvaccinated and thinks, if they're saying people need a third shot, then that's proof the vaccine didn't work. I want to disagree with that very strongly. 2 vaccines will help keep people out of the hospitals and keep people from dying. And that's what we need to focus on, and as quickly as possible. Thank you.